Do you frequently feel like your heart is pounding, even when you're just sitting down? Or maybe you're always tired, no matter how much you sleep. What if I told you these could be signs your body is missing a key hormone? That's where Addison's disease comes in. Imagine your adrenal glands, two small organs above your kidneys, as tiny factories that make hormones your body needs to handle stress, balance salt, and keep your energy up. In Addison's disease, these factories slow down or stop working. So your body struggles to deal with everyday stress. Think of it like driving a car with no fuel gauge. Your body doesn't know when it's running low, so it keeps pushing until it breaks down. Sounds scary it can be, but the good news is it's treatable once found. So what causes these adrenal factories to shut down? Most of the time, it's your own immune system mistakenly attacking them. Yes, your body's defense team, the immune system, gets confused and attacks your adrenal glands, destroying them over time. This is called an autoimmune disease. It's like friendly fire in a video game. Your soldiers attack your own base by mistake. Other causes include infections like tuberculosis, common in some countries, cancer spreading to the glands, or even bleeding into the glands after a serious injury. But in most cases in places like the US, it's your immune system that's to blame. And oddly, it can happen to anyone, though it's more common in people with other autoimmune conditions, like type 1 diabetes or thyroid problems. How do you know if something is wrong? Let us play a quick game. Raise your hand if you have felt unusually tired lately. Or notice your skin turning darker, like a tan you cannot explain, even if you have not been in the sun. These are classic clues. People with Addison's often feel weak, dizzy when standing up, like your head spins. When you get off the couch, crave salty foods, ever eat a chip, and think I need 10 more instantly, and lose weight without trying. Some get stomach pain, nausea, or even mood swings. And here is a red flag during stressful times like an infection, surgery, or emotional shock. The body cannot keep up. This can lead to an Addisonian crisis, a medical emergency, where blood pressure drops dangerously low and you feel extremely sick. If you or someone you know faints after being sick with vomiting and fever, think, could this be Addison's? So how do doctors find out? First, they ask about your symptoms and look for signs like darkened skin. Then they do blood tests, checking your sodium, potassium, and cortisol, the stress hormone. Low cortisol and high potassium, that's a big clue. To confirm, they might do an ACTH stimulation test. This is like a stress test for your adrenal glands. They give you a hormone shot and see if your adrenals respond by making cortisol. If they don't, it's likely Addison's. Treatment, it's straightforward. Replace the missing hormones. You take cortisol, called hydrocortisone, daily, and sometimes a hormone called fludrocortisone to balance salt and blood pressure. Think of it like refueling your car every day. And in emergencies, you need an injectable steroid. Patients often carry an emergency shot in their bag or fridge, just like someone with severe allergies carries an EpiPen. Can you prevent Addison's disease? Well, if it's caused by your immune system, not really. There's no vaccine or lifestyle change to stop it completely. But you can prevent deadly crises. How? By knowing the signs of stress on your body, like fever, vomiting, or injury, and increasing your medicine dose when sick. It's like turning up the heat when it gets colder. Doctors teach patients sick day rules. For example, double the pill dose when you're vomiting. Wearing a medical ID bracelet also helps, so in emergencies, paramedics know not to skip steroid treatment. Also, regular checkups and blood tests help keep the hormone levels just right. It's like tuning a guitar, so it sounds perfect. Small adjustments make a big difference. Now the fun part, what's new? Scientists are working on smarter ways to treat Addison's. Some are testing implantable pumps that slowly release cortisol, so you don't need to time your pills perfectly. Imagine a tiny device under your skin doing the job automatically. Others are studying smart cortisol that adjusts based on your body's needs, like a thermostat for hormones. There's also research into fixing the root cause. Can we retrain the immune system so it stops attacking the adrenals? Early trials with immune therapies show promise. Plus, apps now help patients track symptoms and doses like a digital coach, reminding you to take your meds before a busy day. The future may be one-day early blood tests could catch it before symptoms even start catching the problem, like a weather